A few years ago in India, a young man met with a serious road accident. Doctors tried everything to save him, but after many hours in the ICU, the doctors told the family something very difficult. His brain had stopped working completely. This condition is called brain death. It means the brain has permanently stopped functioning and the person cannot recover. The doctors then gently asked the family a question. Would you consider donating his organs so that other people can live? The family was devastated. In many Indian homes, people believe the body should remain completely intact after death. Some family members were worried that removing organs might affect religious rituals. But the doctors explained something important. Organ donation is done with full respect for the body, and the funeral rituals can still be performed normally. After understanding this, the family made a brave decision. They agreed to donate his organs. That one decision saved many lives. His heart saved a man who was dying from heart failure. His liver saved another patient. Both kidneys saved 2 people who had been on dialysis for years. And his eyes helped 2 blind people see again. One person saved many lives. This is the incredible power of organ donation. Today in this video, we will understand everything about organ donation and organ transplantation in very simple language. We will talk about what organ transplant means, which organs can be donated, what happens when someone becomes brain dead, how organs are removed, stored and transported, blood group matching and HLA testing, cost of transplant and insurance coverage, waiting time for organs, hospitals and government bodies in India and Goa, common myths in our society, and how every common person can help save lives. Let us begin. What is organ transplant? Our body has many important parts called organs. For example, heart, kidneys, liver, lungs. Sometimes these organs stop working because of severe disease. When this happens, doctors may replace the damaged organ with a healthy organ from another person. This procedure is called organ transplantation. For many patients, transplant is the only treatment that can save their life. Some people worry about another common myth. They think if they register as an organ donor, doctors may not try to save their life in an emergency. This is completely false. Doctors always try their best to save the patient first. Organ donation is only considered after death has been medically confirmed. Organs and tissues that can be donated. Organs that can be transplanted include heart, kidneys, liver, lungs, pancreas, intestine. Some tissues can also be donated. For example, cornea of the eye, skin, bone, heart valves. Many people believe that eye donation means the entire eye is removed. In reality, only the clear front layer of the eye, called the cornea, is transplanted. This small tissue can restore vision to someone who is blind. One single donor can save up to 8 lives and help many more through tissue donation. Organ donation system in India. India regulates organ donation through a law called the Transplantation of Human Organs and Tissues Act. Under this system, there are 3 levels of organizations. At the national level, there is the National Organ and Tissue Transplant Organization, called NATO. NATO maintains the national waiting list for organs and coordinates organ allocation. At the regional level, there are regional organ and tissue transplant organizations. At the state level, there are state organ and tissue transplant organizations, known as SOTTO, Sotto Goa. In the state of Goa, organ donation is coordinated by the State Organ and Tissue Transplant Organization Goa. Sotto Goa works with hospitals to coordinate organ donation, maintain donor registries, and conduct awareness programs. An important hospital involved in this program is Goa Medical College and Hospital, which participates in cornea donation and organ transplant coordination. Hospitals in India where transplants are performed. Several hospitals in India perform transplant surgeries. Some well-known transplant centers include All India Institute of Medical Sciences in New Delhi, Medanta, the Medicity in Gurugram, Apollo hospitals in several cities, Institute of Liver and Biliary Sciences in Delhi Manipal Hospitals, Asta CMI Hospital in Bengaluru. These hospitals perform kidney, liver, heart, and lung transplant surgeries. What is brain death? Brain death means the brain has completely and permanently stopped functioning. The person cannot recover. Doctors confirm brain death through special tests. These include checking brainstem reflexes and performing an apnea test to see if the patient can breathe independently. Usually, 2 separate examinations are done by a panel of doctors. Once brain death is confirmed, the doctors talk to the family about organ donation. Even if someone has a donor card, family permission is still required. What happens after family consent? If the family agrees to donate organs, several steps happen quickly. Doctors check the national waiting list maintained by NATO. Recipients are identified based on blood group compatibility, urgency, and tissue matching. A trained surgical team then performs organ retrieval surgery. This process is called organ harvesting. Organs are removed in an operating room with great care and respect. After removal, the organs are preserved in special cold solutions. Organ storage and transport. The organs must reach the recipient hospital very quickly. They are stored in special containers at about 4 degrees Celsius. Each organ has a limited survival time outside the body. Heart can survive about 4 to 6 hours, lungs about 6 hours, liver about 12 hours, kidneys up to 24 to 36 hours. To ensure quick delivery, police sometimes create a green corridor where traffic is cleared for the ambulance carrying the organ. Blood group matching and HLA testing. Just like blood transfusion, organ transplant also requires compatibility. Doctors check blood group matching between donor and recipient. They also perform HLA testing. HLA stands for Human Leukocyte Antigen. This test checks how closely the tissues of the donor and recipient match. Better matching reduces the risk of rejection. Brief explanation of different transplants. Kidney transplant. In most kidney transplants, the patient's old kidneys remain in the body. The donor kidney is placed in the lower abdomen near the pelvic blood vessels. Liver transplant. Sometimes a living donor can donate a part of their liver. The liver is special because it can regenerate and grow back. Heart transplant. The diseased heart is removed and replaced with a healthy donor heart. Lung transplant. Doctors may transplant one lung or both lungs depending on the condition. Eye donation. Only the cornea is transplanted, not the entire eye. Cost of organ transplant in India. Organ transplant surgery can be expensive. Approximate costs in India are kidney transplant around 5 to 10 lakh rupees, liver transplant about 20 to 30 lakh rupees, heart transplant about 15 to 25 lakh rupees. Lung transplant can cost 20 to 35 lakh rupees. Apart from surgery, patients also need lifelong medicines and regular medical tests. Many people worry that transplant treatment is impossible to afford. However, today many insurance companies in India cover organ transplant surgeries under health insurance policies. Government schemes, such as Ayushman Bharat, and some state health programs also provide financial support for eligible patients. Immunosuppressive medicines. After a transplant, the body's immune system may try to attack the new organ. This is called organ rejection. To prevent this, patients must take medicines called immunosuppressive drugs for life. Common drugs include tacrolimus, cyclosporin, mycophenolate steroids such as prednisolone. These medicines reduce immune activity so the new organ can survive. However, they may cause side effects such as infections, diabetes, high blood pressure, or weight gain. Doctors monitor patients regularly to manage these risks. Many patients wait a long time for organs. Kidney patients may wait months or even several years. Heart and liver patients may wait months depending on urgency. Government reports show that more than 80,000 patients in India are currently waiting for organ transplants. Sadly, many patients die before an organ becomes available. Why organ donation is urgently needed. Every year in India, around 2.5 lakh people need kidney transplants. About 80,000 need liver transplants. Around 50,000 need heart transplants. But only a small percentage receive organs because donation rates are low. Some people believe they are too old to donate organs. But this is another myth. Doctors decide based on the health of the organs, not simply the age of the person. Even elderly donors can sometimes help others. Alcohol, drugs, and addiction. Heavy alcohol use can damage the liver and other organs. Drug addiction can also harm organs. Sometimes such damaged organs cannot be used for transplantation. Addiction may also prevent someone from receiving a transplant because patients must strictly follow medication and medical advice. How to identify frauds. Organ transplantation must always be done in government-approved hospitals. Warning signs of fraud include brokers offering organs for money, hospitals asking for illegal payments, lack of proper medical evaluation. Always verify transplant programs through government authorities like NOTO or SOTO. Movies that talk about organ donation. Some films have helped spread awareness about organ donation. The Bollywood movie Traffic tells a real story about transporting a donor heart through a green corridor. The Hollywood film 7 Pounds, starring Will Smith, explores the emotional side of organ donation. Another Hollywood movie, John Q, starring Denzel Washington, shows the struggle of a father trying to obtain a heart transplant for his son. How common people can help. You do not need to be a doctor to save lives. Every ordinary person can contribute. You can register as an organ donor. Inform your family about your decision. Carry a donor card. Spread awareness about organ donation. Even a simple conversation with family and friends can inspire someone to donate. Life is unpredictable, but even in tragedy, something beautiful can happen. One organ donor can save up to 8 lives. Imagine the difference if more people decided to donate. A small decision today could give someone else another chance at life. If you found this video helpful, share it with others so more people understand the importance of organ donation. And subscribe to @Skariva for more health awareness videos that can educate and save lives.